My name is Sandra Velasquez, and I'm a pediatric nurse practitioner in a school in Worcester. During my course, when I started about 19 years ago, the severity was not as complex as it is today. Now I'm seeing children that have a lot of healthcare needs, such as asthma is more prevalent, and diabetes, and mental and emotional needs. An incident that I can remember very well is about 2 years ago. A child with seizure disorders had a grand mal seizure, and the nurse and myself were involved in her care. The nurse was giving her the medication that she needed, and I was providing mouth-to-mouth because she was turning blue while we were waiting for the ambulance to come. We were able to keep her alive before she got the care that she needed. My role provides access for children to have health care because sometimes these children have a hard time getting health care. So by being in the school, I'm providing that access to the children in the community at large. I believe that no matter whether you're in a public school or in a private school, you're going to have health care needs because it doesn't matter. So it's needed.
School nurses bring to schools and the wider community considerable benefits, the least of which are significant reductions in student absenteeism rates and thus vastly improved education outcomes. Other benefits that school nurses bring to both school and community are consequential savings of both time and money. Private schools in Massachusetts educate no less than 10% of the Commonwealth's total K-12 student population. And Massachusetts law has long affirmed that both public and private school students are entitled to publicly funded health services provided by school nurses. That private school students are entitled to these services makes eminent sense for two very important reasons. The first is public health. Propriety and common sense in public health dictate that health services which benefit the common good should be provided where the public is. And as I just mentioned, no less than 10% of all students in Massachusetts attend private schools. The second reason is one of fairness. Relative to parents whose children attend public schools, parents whose children attend private schools pay a more or less proportionate and co-equal amount of both local and state taxes. Since 2002, the Commonwealth's Essential School Health Services program has facilitated the provision of school nursing services to students attending public and private schools. Despite this, private schools have been largely prevented from fully participating in ESHS.
My name's Kelly Randall, and I'm the school nurse at Venerini Academy. I feel like there's a lot more students today that are coming into school with diagnoses such as type 1 diabetes, which is on the rise, a number of severe life-threatening allergies. We also have a number of kids that are coming to school with congenital heart defects that need monitoring. And I just feel overall that more kids with medical needs are attending schools, such as cancer diagnosis, cystic fibrosis, kids that are on special diets or need feeding tubes. A couple of years ago, I had a student that was in second grade. She was struggling academically. She frequently came to my office complaining of headaches and just general feelings of not being well. So I was able to schedule her an eye exam, and with those results, I was able to order her a free pair of glasses. And after that, her headache seemed to have disappeared, and she started to do much better academically. Often my office is the first place that students come to seek medical care, and I feel that the teachers are here providing them knowledge academically, and then I'm also adding to that by teaching them how to live healthy lives and how to advocate for themselves. I feel that no matter what school kids are going to, that they're going to have the same acute illnesses, they're going to have the same chronic illnesses, no matter what school they attend. I feel like parents have the right to school choice if they want to send their child to private school, but the health care that children need should not suffer just because a parent chooses to send them to private school. I feel that sending children to school without a school nurse really is doing them a disservice. It is providing them with an unsafe learning environment.
Therefore, we call on the Massachusetts Department of Public Health particularly, and if need be, both the legislature and the governor, to ensure that for all children simple measures are taken to assure that all students in the Commonwealth have daily and meaningful access to a school nurse.